So the Restoring Hope Act, as Mr. Cole said, is truly bipartisan. I mean, it came out of our committee unanimously. And it's needed more than ever today. I don't think I have to tell any of you that, particularly during the COVID crisis, mental health concerns, use of opiates, all these things skyrocketed. And, my statement goes into the, gives you more statistics about that. But basically, this bill provides the support and resources needed to meet this crisis in both mental and behavioral health head on. And as was mentioned, we negotiated this for months. Myself, the ranking member of the full committee, Mr. Rogers, as well as the two subcommittee leaders that are here today. And it incorporates both Democrat and Republican-led provisions. It's essentially a package of bills from both Democrat and Republican members to seek to battle mental health and substance use disorders. It basically reauthorizes but makes major investments. I don't want to say we're just reauthorizing. I mean, we do a lot to change 30 public health programs. When I say change, I mean, make them more up to date and provide more investments for both SAMHSA, the Substance Abuse and Mental Health Services Administration, and HRSA, the Health Resources and Service Administration. And there's a particular emphasis on children and young people, for which this crisis during COVID was even more severe, if you will. And, it's disorder prevention, it's treatment, it's recovery support services. And the main thing also, it continues investments in the block grants that go to states, but it also extends a lot in terms of mental health screening and treatment grants, and there's a lot of emphasis also on American Indians and Alaska Native communities because the problem was very severe there as well. In terms of the opioid use disorders, I just wanted to highlight two things, and I know this was a little sensitive for Mr. Burgess. I probably shouldn't raise it because he may feel that he has to speak on it. Basically what it does is to apply or provide a federal program, if you will, for providers, training for providers, be they doctors, nurses, whatever. But it tries to incorporate that training that's already done at the state level. So if you did the training at the state level, that counts towards now the federal requirement. And then it also, the other thing I wanted to mention before I get to the manager's amendment is that with regard to BUP, I use that term because it's easier for me to pronounce, we had restrictions on how many cases physicians or healthcare providers would be able to entertain. There was a cap on how many people you could treat with BUP, okay? And this eliminates the cap. And that's very significant as well because we felt that during COVID that cap was very unnecessary and led to a lot of people not getting treated. Now let me talk a little bit about the manager's amendment. As Mr. Cole mentioned, it basically pays for the program. So this is totally paid for. There's about $1 billion in spending, and actually the pay-fors I think are even significantly more than that. But I just wanted to mention that. And one of the things that it does, which I know a lot of you, some of you in the past have expressed concern about the PBMs, and one of the ways that we pay for this is to have reporting requirements for their fees. The theory, it doesn't mandate anything, but if there's transparency and they have to report their fees, then the fees tend to be less, and that's how you save money. The manager's amendment also incorporates a bill, HR 7233, keeping incarcerated discharges streamlined for children. A lot of times for kids that are in the juvenile justice system or awaiting trial, they're not covered by Medicaid. And so we want to make sure that that doesn't happen, okay? And the last thing is the manager's amendment includes language from another bill, the Children's and Media Research Advancement. Oh, this is actually Jamie Raskin's bill. I don't know if he's on the virtual, but it requires the National Institutes of Health to examine the effects of modern technology and multimedia on infant, children, and adolescents. So that was added in the manager's amendment. So that's it. I don't want to prolong this because it is bipartisan and it was actually unanimous out of the committee. I yield back.